seems like there are so many problems, it's hard to pick, the most important, but cost is probably the biggest concern.
Some people, they don't have any trouble going to the hospital or doctor, and there's other people that suffer and they have to stay home, and they don't get the benefits that some other people get.
For example, with private insurance, here it's really easy to see that when someone has private insurance, that a lot of consultants will just jump on the case. It's very easy to get a consult. For example, if someone with Medicaid, for example, it's different. Only certain people take the insurance.
Well, with the insurance, I get a lot of doctors that tell me that the insurance don't cover for this or don't cover for that.
Pre-existing, that's one thing I just don't understand. Why is that an issue?
Older people need help so they can buy their medicine as well as food and pay their rent. So many of them have to make a choice that way.
I just took a buyout from Chrysler Corporation where I had unbelievable health care for several years, and I'm going to be looking for some health care, and so I've been pricing it around. It's incredibly expensive for me and my family, and I have a concern about that.
I just got my health care yesterday. I couldn't make appointments for my eyes or my dentist or anything like that.
Americans are spending more than anybody in the entire world on healthcare, so we're not really getting what we're investing.
I think it's a big philosophical question of what is the appropriate amount of the GDP that a nation should spend on healthcare. I'll leave that to the folks who are listening and watching this video. But I think we could do it much more efficiently and probably achieve most of our goals without spending more money than we already are.
On a day-to-day basis, I think what I would like is simplicity in our healthcare system. What I experience as a family physician seeing patients in our family healthcare center is that our healthcare system is like a bureaucracy with literally hundreds of flavors, so that when patients come in, they can have any one of a number of health plans. It takes a long time to register them because they have all these different plans, and and the people at our front desk don't know whether they're going to be able to pay for the care that we can deliver.
IT is essential for taking care of patients, particularly across in transitions of care. The paper record is obsolete, and we have to move beyond that if we're going to have true healthcare reform.
I think if there were any issue in the United States of America where people need to come together and not be partisan, is on this kind of issue.
I think if they wait, the problem's just going to get worse.
With
the economy going down, people are having a hard enough time as it is to pay for their insurance. Why is it going to get better if we wait?